You know, when you have a new diagnosis of cancer, any cancer, but especially breast cancer, it's a whole new world. You know, you're going along in your life and suddenly you get hit with this. So first of all, there's the classification, there's the tests, there's the treatment. It's impossible to try and understand everything. You know, and that's why I say it's a process. And the harder you try and understand everything, the more frustrated and the more difficult it is. But the only real advice I have is when you come to appointments to bring someone else, always. Because it's been well shown in almost any doctor's meetings with patients, especially at the beginning, that patients only process less than half of what you say. So, and studies have shown this, so that if you come with a second set of ears, you're more likely to walk away with a better understanding. The other thing is that we will repeat again and again what we say at different meetings and through different personnel. So we'll say it, the pharmacist will say it, the nurse will say it. So although you want to understand everything at the beginning, it's really hard to. I would say don't spend too much time on a website. Don't do too much reading, because every woman is an individual patient, and statistics are great for me, but the individual is not a statistic. And so, you know, if you're going to look at a statistic and say 90% of women are alive and disease-free at 10 years, and say, oh, but what about the other 10%? You know, don't spend too much time on statistics. So my advice is to ask your professional for sources that are accurate. I believe we're providing on the site what we feel are accurate sources of information. And I think it's very important. Patients come to me all the time with things that they've read on the internet that are not accurate. So you have to be careful what you read. And anybody could put anything on the internet, and it's not necessarily valid information. One of my favorite sites is the NCCN site. It's the National Comprehensive Cancer Network site. It has a patient site. It has actually cancer sites for every cancer. And when you go on that site, you go to the patient network and you click on breast cancer. It's got lots of information. It's very well presented, and it's free, and it's very accurate. I think that doctors can only present you the medical aspect and help you get through the treatments, but we can never be a patient in terms of dealing with the day-to-day breast cancer. And I think that you can really be helped by listening to women's experiences and how they deal with the day-to-day aspect of it. And I think you can learn a lot by listening to other women. That's why for years and years, we've had support groups. You know, but not everybody has easy access to support groups. Not everybody wants to be out there in a support group. And that's why I think an online support group, or an online, to be able to go online and listen to women is sometimes a lot easier for women than to actually attend a support group. So you can have either or. But you have to be careful, because some women don't actually provide support when they think they're providing support, when all they're telling you is the negative aspect, and they're providing support for themselves more than for the person seeking support. It's just really hard to process everything at the beginning. Eventually you'll get it, but it's hard at the beginning. I think by the time, as a medical oncologist who gives chemotherapy or who prescribes the hormonal therapy, I think by the time you get to your first chemotherapy session, you're understanding it, but it sometimes takes several weeks until you're at that point. So it's very hard, and many people walk away really overwhelmed at the very first session. The relationship that a patient has with her oncologist is different than most doctor-patient relationships. It's close, it's intense, and you really have to trust your oncologist. You're getting a lot of medication, and some patients feel it's a life or death situation. So you have to develop a trusting relationship with your oncologist, and you have to feel it almost from the beginning. And if you don't, then you're in a bit of a situation. So there are two situations where you might want to seek a second opinion. One is at the beginning, before you start treatment, and one is during your treatment if you're not quite so happy. So sometimes it's uncomfortable to ask your own oncologist, and I think it's better if you find your own second opinion. It's not always easy to navigate through the medical world to find your own opinion, but there are other ways that you can find a second opinion. You can go online, because you can get practically anybody's name in any institution online. You can ask the nurses or other health professionals in your own institution if you're not happy, or you can ask in your support groups for other opinions. You have to decide if it's really just a second opinion, if you're just looking to make sure that the treatment you're being offered is the right treatment, or if you really want to change doctors. You have to remember that when you're asking for a second opinion, especially before you're starting treatment, you're going to have a delay in treatment because it takes time. But I think that if patients aren't happy with their primary oncologist, then it's worthwhile to change.